In this channel, I intend to make some useful videos for different diseases and their exercises that you should do. Sometimes hota
Assalamu alaikum and welcome back to my channel, that is Physiowell by Dr. Mariam Sharif. So as usual, I am going to put up a video in which you are going to get benefit about what physiotherapy is and all that stuff. वो मेरी पिछली वीडियोस में भी देख सकते हैं, my intro video, उसमें आपको सारा पता चल जाएगा what my channel is all about.
So talking about today's
This video is going to be very beneficial for those who are working as a healthcare professional, who are doctors, who are a physiotherapist, of course, because this video is going to give you some of the points, some of the key points जो कि आपका doctor-patient relationship बेहतर कर सकता है, आपकी consultation बेहतर कर सकता है, and it can ultimately help your patient to get better and to get comfortable with you, so that वो आपसे अपनी सारी problems share करे और आप उसका बहुत अच्छा solution निकाल सकें. It can improve the prognosis of a patient, it can improve the treatment plan of the patient, because when the history is good, when the examination is good, the treatment and diagnosis also becomes beneficial. So without any delay, let's move on to those tips and tricks that are going to help you in building your professionalism and your healthy patient and doctor relationship. Number one, you don't have to interrupt your patient, especially when they are telling you their history, they are telling you their problem. Do not interrupt them, because अगर आप उनको interrupt कर देंगे, उनको confidence और morale लो हो जाएगा, वो जो बात कर रहे होंगे वो शायद वो भूल जाएं, या उनको लगे कि डॉक्टर मुझे सुनना ही नहीं चाह रहा. So just listen to them first and then make a decision or then ask your questions. Number two, मोस्ट इम्पॉर्टेंट, मोस्ट ऑफ द टाइम्स होता ये है कि पेशेंट आपसे बात कर रहा है या पेशेंट का ट्रीटमेंट चल रहा है, वो आपको अपनी हिस्ट्री बता रहा है एंड यू आर लुकिंग एट द क्लॉक और यू आर लुकिंग एट योर वॉच कि जी टाइम हो गया और पेशेंट जल्दी बताए और जाए. नो, दिस इज नॉट अ गुड प्रैक्टिस. यू हैव टू लिसन टू देम पेशेंटली. You have to give each patient the proper time, no matter what. आपका कितना बाहर रश लगा हुआ है, the patient who has come into you, who is in the consultation room right now, is the most important patient for you, and don't look at your watch. It doesn't look nice. Number three, just smile, because patients जो हैं वो जब आपके पास आते हैं, they are having anxiety attacks, they are sad, they feel low. So as smile is contagious, you all know, and there is a saying that smile is a circle that sets everything straight. ठीक है? So you have to smile, not laugh. Don't make fun of the patient, but be empathetic. There is a very small difference between be sympathetic and be empathetic. You have to show empathy. You have to smile. You have to talk like, yes, welcome, and please tell me what problem do you have. Okay, really nice. So these are the kind of words that you can speak to make the patient feel loved and liked. Number four, just don't be rude to your patient, because patient might have some anxiety attack, patient might have some financial problems, maybe उनको कोई और भी बीमारी हो, साथ कोई और diseases हो सकती हैं जिसकी वजह से they are not feeling well, और sometimes ये होता है वो आपसे rude बात करते हैं, but you have to be professional. You don't have to be rude. You just have to control your nerves and be professional. So when you are rude, patient becomes shy और वो अंडर कॉन्फिडेंट हो जाते हैं. दे डोंट शेयर देयर प्रॉब्लम विद यू, एंड समटाइम्स ये भी होता है वो शायद आपके पास दोबारा ना आए या वो आपसे कंफर्टेबल फील ना करें. सो जस्ट मेक देम फील कंफर्टेबल विद यू एंड try to make them feel that they can share anything with you, because you are going to listen to them and you're not going to judge them, right? 5, when the patient is financially low or they are poor, and just don't overcharge them. Don't overcharge any patient. Don't undercharge and don't overcharge, right? So अगर आपको लगता है कि patient को financial aid की problem है या उनको financial aid की ज़रूरत है, तो प्लीज़ आप उनको रेफ़र कर दें किसी ऐसी ऑर्गेनाइजेशन से जिसको आप जानते हैं, who are welcoming such patients and who are providing financial help to the patient. So just refer them there या फिर आप उनके चार्जेस थोड़े से कम कर दें इफ़ यू कैन अफोर्ड, या फिर just tell them to go somewhere else or just refer them to somewhere else, and or just try to provide them everything, all the precautions, all the medicines, or all the exercise, guide them the exercise in just one session or two session, so that कुछ फायदा हो उनको आपसे. Number 6, the most important thing. I'm telling you to smile, I'm telling you to be professional, I'm telling you not to be rude, but beware, you don't have to be flirtatious. For men and women, for both female and male doctors, there is a very, you can say, small line or a thin line between being empathetic, being friendly, or being flirtatious, because these things can taken up very seriously, and this can create misunderstanding between the doctor-patient relationship, because most of the times patients, if a female patient is uncomfortable with the male doctor, or a male patient feels uncomfortable with the female doctor, this is not going to be good. In my practice, I have seen there are a lot of cases when patient जो है वो doctor जो है वो आपसे professionally as a professional आपसे बात कर रहा होता है, या एक good gesture show कर रहा होता है, but patient takes it like so just make a healthy distance and don't be flirtatious. Number 7, very important. I'm telling this for all the points, but all these points are very important. If a patient comes to you and tells you कि जी फलाने डॉक्टर ने मुझे ये कहा है तो आप तो ये कह रही हैं, तो आपको उसको सुनना है, आपको पेशेंट को गाइड करना है कि हाँ उनके एग्जामिनेशन में ऐसा हुआ होगा, बट एज फार एज आई नो, इन माई प्रैक्टिस, इन माई एक्सपीरियंस, इट इज लाइक दिस. Don't blame the other doctor, don't blame the other professional in front of the patient, and just don't talk bad about the other doctor, because at the end of the day आपकी अपनी ही प्रैक्टिस खराब हो रही है, आप ही बैड साउंड कर रहे हैं और आप अपनी कोलीग्स को खुद ही बदनाम कर रहे हैं. डोंट डू दैट. नंबर 8, होता ये कि पेशेंट आपसे बात कर रहा है, या आप राउंड्स पे हैं, या आप पेशेंट आपको अपनी प्रॉब्लम बता रहा है, या वो एक्सरसाइज कर रहा है और आप सामने बैठ के फ़ोन यूज़ कर रहे हैं. नो, डोंट यूज़ योर फ़ोन अनलेस इट्स एन एब्सोल्यूट इमरजेंसी, या फिर कोई कॉल आई है आपको एडमिनिस्ट्रेशन की तरफ से. It doesn't look nice. So if there is an emergency and you have to take any call or you have to use your phone, just ask for the permission from the patient so that they don't feel ignored, और वो जो है बुरा फील ना करें. Number 9, explain everything to your patient. Your patient has the right to know about what you are going to do with the patient and what is the problem of a patient. उसको सारा कुछ बताएं, डिटेल से उसको एक्सप्लेन करें. अगर उसको समझ में नहीं आता तो उसके साथ कोई अटेंडेंट है जिसको वो अलाउ करता है कि जी आप उसको अपना प्रॉब्लम बता सकें, तो जस्ट टेल देम, गाइड देम एंड विद ट्रूथ, बिकॉज अगर आप सच नहीं बोलेंगे, उनको प्रोग्नोसिस नहीं बताएंगे, सो दैट्स नॉट गुड. डोंट डू दिस. So last but not the least, when the patient is done with you, आपका कंसल्टेशन हो गई, ट्रीटमेंट हो गया, सेशन हो गया, पेशेंट जाने वाला है, तो just don't forget to tell them the means by which they can contact you. Either it's your business WhatsApp number, either it's your email, either it's your Instagram or anything, so that patient can contact you whenever they want, because they have the right to contact their consultant. And for the patients, I would like to say, don't disturb them all the time, because everything has a limit, and you just have. So I hope ये वीडियो आपको पसंद आई होगी. I hope this would have helped a lot of people. अगर इस वीडियो से किसी प्रोफेशनल को, किसी जूनियर को, किसी सीनियर को, किसी को भी अगर कुछ फ़ायदा हुआ हो, या कोई ऐसे पॉइंट सुनने को मिले हों that can improve their practice, so just let me know in the comment section below. For more such videos, you just have to like, comment, share and subscribe so that you can never miss out on anything, because it's all worth it. Thank you.